Hey, Dr. Vinny here. Good to see you again. So we're going to talk about carpal tunnel syndrome. So carpal tunnel syndrome is when the median nerve goes through the carpal tunnel in your wrist and then goes to these four fingers but spares the pinky finger. So people will complain of numbness, tingling, weakness. They have trouble grasping even a steering wheel or opening up a jar. And sometimes they'll wake up and they'll complain of a dead hand where they're shaking it out to try to get some feeling back. A lot of times it's because they're sleeping like this all night long, in which case they're pinching that nerve, or they're sleeping like this and they're stretching out that median nerve. A lot of times what I'll tell them to do is get a Velcro wrist brace over the counter, so something like this, and this way they can move their fingers, but it holds their wrist in place. So this way they can't bend it or stretch it out. You wear this for about 4 to 5 weeks. Other things you could do is rest, ice, take an anti-inflammatory if okay with your doctor. At 4 to 5 weeks, you're not better, maybe a steroid shot we can try, and if still not better, surgery. People I see this with is assembly line workers or people who use vibrating tools. Thanks so much for watching.